Jane Morgan, a cardiologist and executive director for health and community education at Piedmont Healthcare in Atlanta. Good to have you back, doctor. Of course, they don't want to wait until they start getting reports of some of these really severe reactions to this, but tell us more about what's happening here, and people should just throw this out, right?
Well, actually, they should return it.
Return it.
And we wanted to keep track of what these lots are. And so far, there aren't reported cases, which is very good. So they're preemptively making certain that they pull these off the shelves. But there seems to be something in the manufacturing process of this particular honey flavored syrup. And so we want to be careful. It sounds as if there's some type of yeast or fungus infection in the manufacturing process in the plant. And these plants are located within the United States. So they're pulling these off preemptively. There have not been any reports of people being sick yet. But if you start to have any symptoms, make certain that you see your physician, but also make certain that it's reported, and there is a website to do that.
Yeah, I mean, so they must have figured this out through the manufacturing process, right? That something had gone wrong for them to issue a recall without having any reported effects, right? And also, I just want to ask you in terms of symptoms, like what should people be watching out for if they say, oh my goodness, I took a couple of, dosages of this?
Right, and so the manufacturing process has inspections, and there was fungus noted in the inspection, higher than whatever the standard measures are for that. And if you were to get sick, generally it doesn't impact people who are healthy. It's going to impact people who are immunocompromised, people who have some type of weakened immune system by and large, and therefore they may start to have fever and weakness and cough and malaise, meaning they start to have decrease in energy. These are the types of things that we need to make certain that you're aware of and make certain that you seek medical attention, because it really can be fatal in those who are immunocompromised. And we always want to look out for the people who are vulnerable in our environment.
Speaking of looking out for people who are vulnerable, there's some changes to COVID regulations and advisements out in the West and Northwest. California and Oregon are no longer expecting people who've tested positive to isolate for a set period of time, and those without symptoms don't have to isolate at all. I mean, is this, test positive, go to work, treat it like it's a common cold? Where's the science on this?
And so the science is one thing, and the regulation is something else.
Sure.
So the science still shows that you are infectious up to 5 days after you test positive and have symptoms. But what the reality is that people are either not testing or testing and ignoring the results and moving around because of any number of reasons. They don't want to miss work, or maybe not even wanting to put on a mask because they don't want to draw attention to the fact that they may be sick or infectious. And so this appears to be more of a practical consideration of how to manage the public as opposed to a scientific consideration, because the science is still the science, and this is the infective period.
Do you feel like anecdotally that the flu season hit much harder this year than COVID did?
It appears that it did not so far in 2023, and we are now in January of 2024, so we don't have the full January numbers yet. So all the way through December of 2023, we had about 20,000 flu deaths. As compared to COVID, we had 73,000 deaths.
Oh, wow.
So when we look at COVID, there were actually more COVID deaths than flu or even car accidents. And so COVID continues to lead the charge of all of our potpourri of viruses. It continues to lead the charge for deaths, even though hospitalizations this month in January 2024 are lower than hospitalizations in January of 2023.